Before watching today's vlog, please read the disclaimer in the description below. Thank you. Today we're going to talk about sinus infections. Normal, healthy sinuses drain mucus into the sinus passages every day. That helps to moisten the air that we inhale. Nasal congestion can develop due to inflammation, swelling, or a buildup of nasal fluid. This can lead to obstruction of the sinus cavity. If your sinuses become obstructed, they can't drain mucus properly. Some of the causes include allergies, such as hay fever, bacterial or fungal infections, viral infections such as the common cold, obstructions such as nasal polyps, sinus tumors, or deviated septums. Additionally, environmental exposure to cigarette smoking, sawdust, or chemicals that you use at work or at home. Also, dental abscesses or throat infections. Someone who develops chronic sinusitis is somebody who has had a persistent sinus infection for more than 8 weeks despite treatment. Surgical intervention or steroids may need to be applied by the doctor in order to treat this individual with chronic sinusitis. Also, they may need to see a specialist such as an ear, nose, throat specialist. Symptoms include pain and tenderness to your face, head and nasal congestion, yellow-greenish nasal discharge, a fever, a headache that worsens when you lay down, a decreased ability to breathe through your nose, bad breath, extreme fatigue, ear pain, your eyes and your face may appear to be swollen, pain to your upper jaw and teeth, a decrease in your sense of smell, and a cough that usually worsens when you lay down due to postnasal drip. So let's talk about treatment options. The first thing you want to do is you want to treat the cause. If you have a bacterial infection, you want to treat it with an antibiotic. If you have a fungal infection, you want to treat it with an antifungal. Now, in terms of the antibiotics, it's very important that you complete the entire course of treatment. If you have a 10 or 14-day treatment, then you really need to complete the whole thing, even if you're feeling better. Don't stop because you feel better. Don't stop or share with somebody else or save some for the next time you get sick. What can happen is that you can develop resistance to that antibiotic, and then you won't be able to take that treatment again the next time that you get a sinus infection, and we don't want that to happen. If you have a viral infection, unfortunately, there are no antivirals to treat sinus infections. If it's a viral cause, basically you would have to treat the symptoms. So the next thing we're going to talk about are symptoms that we can treat. So let's talk about symptoms and how we can treat them at home. One of the things that you can use are nasal corticosteroids. They help to decrease inflammation and congestion in your sinus passages and allow you to drain your sinuses better. For example, Flonase is something you can get over the counter. Nasonex is something that you can also get, I believe, over the counter. If not, then you can make sure that you speak with your doctor about getting a prescription sent to the pharmacy. Another over-the-counter medication or over-the-counter medications that you can try are oral decongestants. Decongestants include Sudafed, Drixoral, pseudoephedrine, Actifed, and what they do is they decongest your sinuses and your head and allow you to drain better as well. If you have high blood pressure, you may want to try Coricidin HBP. And what that is a decongestant specifically for those with hypertension or cardiac history. Decongestants can cause an elevated blood pressure and a racing heart. So please speak with your doctor before getting those decongestants. Also, if you have a history of thyroid problems or an enlarged prostate, please use caution because prolonged use can cause you to have problems with those conditions. Now, the average treatment on a decongestant is about 10 to 14 days, and I would not use it any longer than that. If you feel like you have to use it any longer than that, then you may need to be reevaluated by your doctor. Another decongestant is a nasal decongestant, for example, Afrin nasal spray. This can help for only a short period of time. It is not recommended for long-term use because you can develop nasal dependency. And it is very important that your sinuses be able to function on their own without the use of medication. Now, for allergies, you can use antihistamines such as Benadryl, Zyrtec, Allegra, or Claritin to make yourself more comfortable. Those you need to take on a routine basis. You can't just take one every once in a while. You really need to take it routinely in order for it to be effective. For fever and pain, you could take Tylenol, also known as acetaminophen, Motrin, also known as ibuprofen, and naproxen, which is also known as naproxen. Now, one of the things that you can do is to moisten your sinus passages to help to thin out the mucus so that you can drain better. And one of the things you can do is get a neti pot. It has proven to be very effective and very soothing in reducing the inflammation and also to help rinse out the sinuses. You can also use a normal saline nose spray, steam from the shower, and also you can try getting a vaporizer or humidifier with either a warm or cool mist, whichever you so choose, to make yourself more comfortable. Other things that you can do is raise the head of your bed or sleep with plenty of pillows. Get plenty of rest. It's exhausting to have a sinus infection. Also, drinking lots and lots of liquids to help thin out the thick mucus in your sinuses. And also make sure that you avoid anything that is irritating your sinuses, like cigarette smokes, chemicals, or sawdust. Additionally, you may want to avoid aspirin if you are under the age of 18 to prevent Reye's syndrome. If symptoms persist for more than 10 days after you've started treatment with an antibiotic or an antifungal, and you're not improving at all, then you really need to go back for a medical reevaluation. When medication efforts fail, sometimes surgery has to be performed to correct the infection and the obstruction, whatever is causing the obstruction, and you may need some sort of steroid to decrease the swelling in your sinus passages. Now, that's basically the end of the video. If you would like to make any comments or have any questions, please do so below. If you like the video, please don't forget to hit the like button. And I will see you next Monday for our next vlog, whichever it shall be. It'll be a surprise to you. And please, again, you may do further research by looking at the resources I've indicated in the description below. Thanks and have a great day.